Welcome to the Business Spotlight. My name is Jada Walker. I am your host for today's conversation, and my guest today is Justin Louie. He is the owner of Advanced Dental Care of Austin. Today, we'll be talking about his business, journey to business ownership, challenges, best practices, and share a peek at what it's really like to build and operate a business. So, Justin, welcome to the show and thank you for being here today. I would love for you to share a little bit of your background of who you are and tell us a little bit about your business as well.
Absolutely. Hi, everybody. My name is Justin Louie, and as Jada said, I'm the owner and dentist at Advanced Dental Care of Austin. I've owned this business for almost 4 years now, and have been a dentist for about 13 years. So it's been a lot of fun, just sort of growing from a clinical perspective and really taking care of our patients, and then growing in the business ownership side of things. Um, a lot of times dental schools and I think a lot of other professional schools don't necessarily give you like really great business training and classes and things of that nature. So some of it is learning as you go and trying to figure out what works best. But I think as long as you have sort of like that guiding light on what you're trying to do and trying to achieve, things work itself out and you'll grow along the way and just have to kind of accept that growth process of this journey, which is not always easy. Oftentimes it's very hard, but it's a fun and rewarding process.
No, really. So let's set the stage for our viewers and listeners real quick. Generally
Mhm.
speaking, what does your current ownership structure look like? Are you the sole founder and owner, or do you have any type of investors that you have to deal with?
Yeah, that's a good question. For us, we're actually solely owned by the company, the LLC that I created to do this. I
Hmm.
had acquired this business about 4 years ago from a previous dentist who has had his business or this practice basically serving our surrounding population for about 40 years or so. I don't remember the exact date, but it's been around for quite a long time serving the Austin community. But it is
Yeah.
just me as far as the ownership side of things. I'm trying to raise and bring about a lot of really solid, good team members to help me deliver great dental care. Without them, I can't do it. So that's kind of how our ownership structure works, but how our business is working.
I like that. And for the people here in Austin,
Mhm.
you are located over here in North Austin because we just talked
Correct.
about that. So
Yeah,
anyone in North Austin, go to this dental area. It's like right down the road from the HEB that's off of what is that, Palmer and McNeil.
correct. That's
I
right where we
was really
are.
like, yeah, I was like, I go to that HEB all the time. I have to pass you all the time.
That's so funny. Yeah. Our practice address is 6500 McNeil Drive. We're like kind of in the middle between 183 and Farmer, super close to the Apple campuses that are out this way,
Yes.
Northwest Austin, like really close to the border of Cedar Park. So
Yes. So let's talk a little bit about your role that you currently play in the business today. Like,
sure.
what does your day to day kind of look like being being a dentist and being the owner of the dental office?
Yeah, that's a great question. I am still trying to figure all of this out. We I think when I first started thinking about dental business, I used to think, oh, the dental business industry is so different compared to other business. We're special, right? It's dentistry. Nothing else is the same. In actually working with Action Coach and just my general evolution, I guess, in business ownership, I'm actually starting to see that there's a lot of common threads with business in general. And while there are some
Mhm.
nuances to dentistry specifically, at the end of the day, it's still a dental or it's still a business. And we are very much a service oriented business trying to help provide services to our patients. And sometimes the way I describe it is that we are, again, just service oriented, but we just happen to do dentistry. Like that is just what we do.
I
Um,
like that.
but the days are a little challenging because I found, at least for
Mhm.
myself, it's really hard to do administrative and CEO type level things as well as doing clinical dentistry all in the same day. So I've had to to kind of separate the two so I can focus in on whatever it is I need to be doing. But currently I spend, like a normal job doing clinical dentistry, about 35 to 40 hours a week. And then after that, I'm spending time doing administrative, CEO, bigger thinking, business thinking, level tasks, coaching, like with Action Coach, outside of those
Yeah.
35 to 40 hours. So it's very time intensive. And I think the reason why it also has been complicated is because, um, again, the dental industry is a little bit nuanced in where, from a business perspective, the people, I guess, generating most of the revenue in the business tend to be
Hmm.
the providers, right? The dentists,
Hmm.
hygienists, things of that nature. So as the dentist and as the owner, that time is split between the revenue generating tasks and the things I can do, the
Yeah.
services I can provide, and then again, all of this extra stuff that kind of has to be done, um, off to the side. And so finding a good balance between that is really helpful. And again, I'm just trying to figure out how to best make this separation and
Yeah.
sell in both avenues.
So would you end up doing more of one than the other at some point? Like, let's say, because I'm like, you're a dentist. I feel like it's almost like a doctor. Like, you want to keep doing like your job and like you want to keep helping people,
Mhm.
but like being the business owner, you're like, I have to sit down and do all these things. So, would you end up taking a break from doing the dentistry, or would you maybe hire someone to do like more of the office work so that you could do more of the dentistry? I don't know. My brain's kind of like, what would you do?
That's a good question. And the truthful answer is I don't really know. It's actually been one of the things I've kind of struggled a little bit with over the past maybe year and a half or so, of really diving into what what I want out of this. When I acquired the business, my intention was always to make it a business, to make it operate without me. That does mean that at some point in
Yeah.
time, and I don't know when it's going to be, I would like to not be dependent, or the business to be dependent upon me sitting in a dental chair doing the dentistry. But I love taking care of people. I love taking care of our patients. And then it kind of led into me trying to decide or understand, if I spend that time in the chair, then yes, logically, I'm going to have to spend less time doing some of these other things. And so I'll need to develop a group of people around me that can, serve our
Yeah.
patients and to give them a great customer experience. Whether that be, I have some of my patients being seen by like one of our associate doctors, or I do some of, or delegate some of the administrative stuff over to a manager. As we grow, scale, as we take care of a larger part of our community, um, this may change over time. And I think it's really going to be dependent upon like the people that I can bring about to help build up this business, to really just be a good pillar of the community. Like, I want us to be known
Yeah.
for being here for people, right? Like, it is healthcare. Healthcare, unfortunately, over many years of history has kind of become, uh, maybe a little bit too capitalized. Like, I don't think there's nothing, or there's anything inherently wrong with that, but comes a
Hmm.
point where if you have too much focus on the business, then you start to lose out on the relationships of people.
Yeah.
And I do feel like at the end of the day, healthcare requires some form of trust with either the business, the brand, the doctor specifically. And I guess just with how that industry has evolved, like, I want to make sure, like, my goal with our practice is to be able to grow, to do these things, to always be people focused first,
Yeah.
to run a good business, but to be people focused first.
Right. Because a lot of people, they won't even go to the dentist. One, because they're scared. People are just scared, especially of needles. Like my brother, my brother's the biggest baby about needles. He hates going to the doctor for getting shots. He hates going to the dentist whenever they have to like numb him to do anything.
Yeah, for sure.
But it's like, it's like you guys need to take care of your teeth health. Like people only they don't, it's
Yeah.
like they don't think about it. I'm like a I swear, like I love flossing my teeth now. I used to be someone I didn't used to floss, but I love to floss my teeth. My best friend, she was a dental assistant for in the army. And she told me one time, she was like, not flossing your teeth is like not wiping your butt crack. And I was like, oh, Oh my God. And so ever since then, I've been like, yep, I floss every single day. And it's also crazy because I swear my teeth have moved more since I've been flossing and like straightening out more. So if y'all ain't flossing, you better floss more. And people
Yeah,
ask me all the time, they're like, have you had braces? And I'm like, no, I just floss. And they're like, that's wild. I'm like, yeah, I just floss and go to the dentist, y'all. Go to the dentist.
yeah, absolutely. And just to kind of piggyback off of that, you're totally right. Like prevention, I know that, it's so cliche to say, but like an ounce of prevention is worth its weight in gold, whatever, right? Like it's so true though, because most of the problems that we see in dentistry, like if you wait until there's pain, if you wait until there's a problem, until your tooth breaks, like sometimes the fixes or the things that we can do to help a patient at that point, like they become more limited or they become
Yeah.
like bigger procedures, they become more expensive, they become things that we don't want to deal with. But if we're taking care of things early, if we're being proactive, if we're trying to be preventive in just supporting our patients and their oral health care, then a lot of these things can be limited. Like at one point in my life, I know it was before ownership. I kind of joked that it would be great if everyone just took care of their teeth like ahead of time. And like if I didn't
It
have to
would.
drill a tooth or if I didn't have to do a filling or a crown or root canal ever again, that'd
Right.
be great. That would mean people's oral health care is like, amazing. From a
Right.
business side, obviously I wouldn't want that entirely, but to be fair, like there's always going to be an issue. We're using our mouth all the time, right? You're eating food, you're snacking throughout the
Exactly.
day, you have at least 3 meals a day. Like these things are meant to last a long time and they can if you take good care of them, but they're also being used. So if you're opening
Right.
beer bottles, if you're, like tearing into snack bags or whatever,
Right.
like
And I've
things
seen
are gonna
people like
wear
chip
out.
their teeth, and I've been like, oh
Yeah,
no, it makes me stop
yeah,
doing what I'm doing. I'm like, I used to do that. And I'll be like, oh
yeah.
God, like, no.
Exactly. And a lot of those things, you do it once or twice, it's probably not going to be a big deal. But if it becomes a
Right.
habitual part of your life, then it's all of this wear and tear that accumulates and builds up over time. And it gets to a stage where then people will actually have problems and have issues. And so even the people who take care of their teeth the best, it's not that they're immune from issues, right? Accidents, all that kind
Mm-hmm.
of stuff is always possible in anybody's life. And obviously, you never want it to happen. But so many things can be prevented if we just
Actually
did
went
things
for a little
early.
yearly checkup or whatever, you know?
Okay. Yeah, or at the very least, then you have a small cavity instead of, waiting till it hurts and then now it's a root canal and a crown, or you have to take out a tooth because it's no longer savable. The conversation switches
Yeah.
from how do we maintain and repair to, we got to remove and replace. What does that look like? What's
Ugh.
best for the patient? So I get it. It could be a lot, but I would just encourage people, let's see your dentist,
Right. It's like
get
go before the problem so that you don't have to have the problem and have to pay so much.
yeah, yeah, don't wait for there to be a problem. If the dentist kind of identifies something early, like, you know, maybe there's a reason why we're telling you about a
Right.
recommendation.
Right. Exactly. I'm like, we're on the same wavelength. I'm definitely someone I'm like, my oral health is very important. I'm like, people, they see that whenever you're talking. That's the first thing I look at is people's mouth. I don't know why. I'm just like, boop, drawn to it. And then I'll be looking at their teeth and I don't mean to because I'm a person, I like stare too. So I'm just like, I'm
Sounds
so
like you
bad
should
at
have
it
been a
too.
dentist. I feel like
I
I do that
probably
now.
should have. I really probably should have been because I'll be like, oh my gosh, like I need to take you to the dentist, whoever you are. I don't even know. I don't even care. I was like, I'll go to the dentist and sit there with you. Like, you need someone to go with you? I will. I don't care. um,
I love it.
so let's actually talk about what makes your business so special. So, of course, you guys serve anyone who has teeth, of course, but what other services do you technically do? Like you said something about like a root canal and all of that. What services do you guys do?
Yeah, actually, great question. And I will kind of slightly correct you a little bit. Even people who don't have teeth would still recommend that they go see the dentist. So if you've
You're
got
right. You're right. Because
dentures or
gum
if you
disease.
don't have, I mean, yeah, so even people who have like full dentures, they don't have any teeth left in their mouth, like
Oh,
we still recommend that you go see the dentist, like we're not going to be checking for cavities anymore. You can't get cavities. You probably won't get gum disease. But when you don't have teeth, a lot of things change. Your ability to eat, the
Hmm.
skeletal structure, all of this changes. Dentures may not be as fitting as they once were. If you're not keeping that clean, then you basically just trap food and bacteria underneath your gums,
Ugh.
and that just leads to more issues over time. So, while
Yeah.
most people, most healthy people, we recommend seeing the dentist for an exam at least a couple of times a year is for edentulous patients or people who don't have teeth. Would say at the very least you should go once a year, and dentures are only ever going to fit as well as they do the day they're delivered because everything changes, the body changes, everything shifts over
Yeah.
time. Eventually, the dentures don't fit so well. So you might have to talk about making new sets of dentures or relines, or I don't know, talk about how to retrofit a current denture to be more supportive with implants or things of that nature. I know I just went down a little bit of a rabbit hole for like edentulous patients and dentures and such, but we do so much
But it
more
is
than
like
just
they're
that.
important too. Yeah. I'm like, they're so
They're
important too.
just
I'm like, my,
important.
my granny literally has dentures and sometimes she'll call us without them in and I'll be
Yeah.
like, do you not have your teeth in? Cause like she'll have the phone, like where you can't see.
Yeah.
And she'll be like, stop talking about me.
Yeah.
I'm like, girl, who cares?
That's funny, especially with family, right? There should be no judgment
Yeah,
there. It's fine.
right? I'm like,
Um,
lady, I've seen you, like it's fine.
yeah. But to answer your question originally, I'm sorry to cut you off and go back to it, but
Yeah.
essentially, like our office, our goal is to really be a place where any of these procedures can be done. Like I want us to
Hmm.
be sort of like a one-stop shop. We're not quite there yet and being able to
Hmm.
bring in a lot of different specialties, but my goal is for us to be a place that provides like a great dental experience, great dental care that will feel comfortable with us, that we can bring in trusted providers to be able to do a wide range of procedures. Now, this isn't to say that every single patient will be taken care of every single time only by us,
Right.
but we'll obviously kind of know where something is maybe outside of our wheelhouse. And our
Hmm.
primary goal is to always make sure that our patients are getting great dental care. So whether that's me that can perform that dentistry, my associate that or associates that can perform the dentistry, or whether it's a specialist that I think is going to be best for a patient. Like I'm going to make the recommendation as far as what I think is best for the patient. And we have really great relationships with a lot of the specialists in the area as well. So like
Oh, that's nice.
the very least, we can point you guys or point whomever for whatever the issue is in the right direction if we don't feel like we are the right fit for them to take care of the patient.
I love that because I just feel like it's so hard to find trusting people or just like, I don't know, especially when it comes to your health, you just want the best.
Mhm.
Everyone wants the best, and like you don't want to have to go searching on Google for everything. So I love whenever you can go to like the doctor's office or the dentist's office, and they're like, you
Yeah,
should go to this person. Because then I'm like, yes, you just relieved so much stress off of me that I don't even have to. I don't have to do it. So I
yeah,
always love that part about going to the doctor or the dentist. I'm like, yes, you guys are the best.
yeah, and exactly. And so, like, that's kind of how we operate too, right? If I like, I obviously I want to do dentistry. I want to do more of the work itself because that's from our business perspective, it's what's generating the revenues. But if we lose sight of the patient focus being there, then we start to fall into that trap of, oh yeah, well, I'm just going to do this because you're going to pay me money, even if I'm not going to be able to do it right or
Right.
well, or maybe I'm not the best place for it, or somebody else is better suited for this. Like there's a lot of that nuance there. And so a lot of times when I'll tell patients, especially if they're kind of giving me some signs or signals that they're not quite sure, they seem uncertain in a
Yeah.
particular way, like look, go find another dentist, go talk to another dentist, second opinions, whatever. Like whatever you end up doing, whether it's me that does dentistry for you, my business that does dentistry for you, like I would just encourage you to be comfortable with wherever you are, because it comes back to that core tenet of being able to establish that trust with a patient. If you don't have it, you just like, it doesn't matter what recommendations we make, like you're just not going to believe
Mm-hmm.
us. Like, oh, the dentist is just the sleazy car salesman or whatever, right? Like you're
Right.
gonna find people in any industry that are either good or bad, and so you got to find somebody that you trust, somebody that is you believe is looking out for you, and just try to stick with them. Like that's so important, I think, for healthcare as a whole, and for that relationship to be there and not really be dictated or tainted by you know uh, going to use insurance here because that becomes such a big part of people's like day to day. But you got to find someone that you trust. I think that's really what's most important with healthcare as a whole, not just dentistry, but healthcare as a whole at the end of the day.
Yes. So I this actually kind of just popped in my head.
Sure.
What do you do for people who maybe they can't really like afford because sometimes some things are like very expensive, and I like that's kind of what freaks people out too. They're like, oh my God, like how much is this gonna be? Like how much money am I gonna have to fork out? Especially around rough times, whenever life just
Hmm.
keeps happening to everybody. And then plus like the pricing of everything and the economy is just going up. So what do
Yeah.
you guys have anything in store for people who maybe like can't afford it right then and there and like I'm like a payment type of thing. Like, sorry, I'm like the word wasn't coming to my head at first. Do you guys have like payment
It's
plans or
okay.
anything? Because of course, like I've seen it at like doctor offices before, but I don't think I've seen it at I don't think I've seen it at dentist offices before. I've never been the one that had to pay for my dentistry yet. Like my mom still paid for it, you know. So I was like, I
So
don't
that's
know.
the best kind of insurance right there, parental insurance, right?
Exactly. I'd be like, Mom, I need your help.
Good question, though. Yeah, so we do offer a variety of ways for patients to try to afford the care that we recommend, right? For things
Right.
that are kind of urgent, we got to get things done now. Sometimes maybe you don't have as many options available. Depends on how proactive a patient wants to be, kind of leads to what the overall recommendations or treatments are, right? Everything is always customized to a patient individual, what's going to be best suited for them,
Right.
what we feel like is going to be best for their health. But yeah, we do offer payment plans. Although our goal is really to try to help people get from the business side more of a prepayment plan. Um,
Mhm.
there have been some laws that have changed relatively recently, and I don't know the exact dates or the specific laws, but it kind of had to do with medical debt and credit scores, where it like no
Oh,
longer
okay.
affects credit scores. So like
Oh,
for a lot of
really?
dental offices and medical offices now, like people are starting to make the shift of trying to collect more of this up front because it avoids a lot of difficulties of chasing people down for payment later. Um,
Yeah.
a lot of administrative resources go into like the collections efforts of this. And a lot of times,
Mm.
dental insurances take 30, 40, 50, 60 days to pay for it. And then if we get a payment 60 days later, then we call the patient up and say, hey, your dental insurance finally paid us. This is what you owe. They're going to be like, I don't remember doing anything, but you never said anything. And it just leads to this whole convoluted situation where it's hard to, at our office, we always try to be as transparent as possible with all of these
Right,
things.
of
But
course.
that being said, insurance companies are not, I don't want to
They're
turn
not
this
used.
into like a piss on insurance show, but they definitely make it hard uh,
They do though.
being sort
Like,
of a,
'cause I
a
know
middle.
exactly what you're talking about.
Yeah. Yeah, it
I'm
can be
like, yeah,
really,
the
really
insurance companies
challenging.
can. Yeah, I'm like they
Yeah,
just need there needs to be like a better system or something like, or at least just faster. Because what 60 days? Like that's too
it can
long.
be
Like,
it can be pretty ridiculous. Yeah, there's a lot of nuances in that, and I would not call myself like an insurance expert by any means. But what I will try to tell patients is like, look, dental insurance actually is not insurance. It's not like your medical insurance, it's not like life insurance, it's not like home and auto insurance. Dental
that's
insurance
really
is
good
more
to
like
know.
it's like a coupon book. It is your little Sally Joe coming over saying, hey, I'm trying to raise money for my pizza party. If you pay me $200 for this coupon book, you can save $1,000, right? Like, but you got to buy everything in the coupon book. So dental insurance, unfortunately, has been challenging for the patients because it pits they almost kind of like invade that space. The dental
Hmm.
insurance's direct contract is with the patient or the customer, and
Hmm.
usually, whatever that plan is generally going to be provided by the HR department of wherever they work. And this HR department gets to decide what level of benefits, coverage, and all this kind of that goes into it. Because at the end of the day, the insurance company is a business. They want to make money. I get that. We all want to make sure
Right.
we're running solid businesses. But when they choose to deny claims for whatever reasons, and then, patients are then on the hook to have to pay for whatever treatments are being recommended. A lot of times the dentists are get kind of painted in the middle as this bad person. oh, well, the insurance company said they won't pay for this, so you did work you weren't supposed to do. There's so many levels to this. And that's why I always kind of go back to the original thing we just talked about, where you want to make sure that whatever dentist you go see, that you trust them, right? Because that's where that basis is going to be. So at our office, we
Yeah.
always try to be as transparent as possible, but we understand that dental insurance is such a big part of most people's lives in terms of how they choose to afford dentistry. They're not saying, oh, I'm going to set aside $100 a month for future dental care, right? That's not part of their emergency fund. Most of the times they're they're going to be doing life just like everybody else. So we try to help. We
Yeah.
want to be a part of the community by accepting as much or as not as much as whatever dental insurances that we feel are helpful enough to the patients, but also helpful enough to us. Because if they don't reimburse us adequately for the procedures or the work that we're doing, then we don't make, like from the business side, we don't make enough money. Our margins, margins get down. Our ability to provide care gets diminished because the only way to compensate for it is either large volume. So then you're seeing a ton of patients all the time. Patient
Hmm.
customer service falls. You kind of feel like a mill, and I just don't want that. So we're doing our best to kind of like walk the tightrope in order to serve the surrounding community as best as we can. But for patients who are uninsured, we also offer like a membership plan. So it's not
Oh,
dental
cool.
insurance, but very similarly, you can make payments that we can customize to you as far as what you want, how many cleanings a year you want. Do you want emergency things or emergency exams to be a part of this or not? Excuse me. And it kind of, it changes the amount that you would pay on a monthly basis. But for people who are, say, older, they're retiring, they're not going to have
Hmm.
access to their dental benefits anymore, then this is an option for them. And I always tell the patients too, like, look, if this is something that works out for you, great. By all means, like if you trust us already, this is really great. We don't have to deal with all of the ins and outs and the restrictions of insurance stuff. Like you get
Right.
your exams, you get your cleanings, you're covered in emergencies. And then if we do need to do any work, you just get a straight discount off the top. There's no hustle bustle, there's nothing else there. You don't have to worry about hitting your maximum and going above it. Like you just know already what's going to be covered and what's not going to be covered. It's easier, I
I like
guess.
that because I'm like, that's just plain out. It's out there. Like, yeah, I like that. Look, I'm like, I'm really about to come to the dentist office.
Yeah, yeah. Come on over, give us a call. Happy to take care of you and all your family. I mean, that's essentially what we're trying to do. We're
Really?
trying to be the community, a dentist that supports this community. So that means seeing children, I mean, like my daughter comes to see me. I see her every night. But like I worked in a previous job, worked with a lot of children. So we have a good pediatric like foundation. We don't have a pediatric
Oh,
specialist
nice.
as of this time, but I've worked on children as young as like 6 months old, all the way up to,
Oh, really?
adult
I was gonna,
people
I was
that
gonna
are
say, I was gonna ask like what the
much
youngest
older.
was because my daughter, she's 2, so I'm like,
Hmm.
do you work on 2-year-olds? But you said
Hmm.
6 months. That is crazy. I didn't even know that you guys would
Yeah.
look at like a 6-month-old mouth. Is that
Yeah. I
just
mean,
kind of
we'll
to like get them
definitely,
used to going to the dentist or
yeah,
nice?
that's a really great question. So, a lot of times it is. Early on, you want to try to get them comfortable with going to a dental office. And I will say, like those appointments at 6 months of age, 1 year of age, stuff like that, a lot of the time, it's less about the kid and the child just getting used to it and more so to answer the questions the parents may have. Oh, little
Mm.
Johnny's tooth started coming in. Do I have to be worried? At 6 months and a year, sometimes enough of those front teeth are coming in. And if they don't have a whole lot of space, like I can have a conversation with mom and dad and say, hey, look, I don't know what the future is going to hold, but usually when we see this, probably going to have a lot of crowding in the teeth when she becomes a teenager and
Mm.
adult. We should start looking at or thinking about when we would want to either make a referral to an orthodontist for early intervention. Do we even need to do it? Do we not need to do it? Um, Maybe if they're not thinking about the financial implications of what that might be in the long run, be like you can start asking your HR department if they have ortho coverage for your kid, at what age, what that looks like, or at the very
Yeah.
least just start setting aside a little bit of money for what might be a larger expense in 6 years and 10 years, so you kind of know ahead of time. So a lot of this stuff we can
Wow.
have these conversations with parents proactively, and just kind of be there to help support and answer those questions. Like childhood decay is really, really scary. Like when you get a lot of
Yeah.
cavities in children's teeth. And
Yes.
I
And
know
I've
this is
seen
not
some
really
children's
a,
teeth where I've been like, oh, like how did that even happen? Like one of my friends'
yeah.
daughters actually had a mouth, oh my gosh, a mouthful of cavities. I think like they
Mhm.
ended up going to the dentist and they said it was gonna be like 700 something dollars. And I was like, what for her mouth? I was just like, oh my God, like seven
It
hundred
could
dollars for one
be,
kid.
yeah,
And she
it
has
can
like
be
five.
really
I was like,
impactful.
oh
It can be really impactful. And it's kind of heartbreaking when you see those situations because you know most of this could have been prevented if
yeah.
people knew what they needed to know ahead of time. So that's part of why we're willing and able to see children early is because it's that educational content. It's the information that will be helpful, not just at that moment in time, but how does this affect childhood development? What downstream
Mm-hmm.
implications may they have? What other challenges may the child, have to deal with when they're older in their teens or as an adult? And
Or
so,
even just as being a
yeah,
kid, because kids are mean. Kids are really mean. I took my daughter to the park one day, and there were these kids. They weren't mean to her. They were being mean to like this other kid that was trying to talk to them. And I was like, oh,
hmm
where are your parents? Because I was like, that is so mean. Just play with him.
yeah, kids
They're
can be mean too. Luckily, even with all of it, I still have all 10 of my fingers. So that's good.
right. I'm like, I'm surprised you don't get bit all the time. Like, geez. Oh my God. I feel like if I were to bring my daughter in, she probably would bite you on accident. She's wild.
I
That
played a
3-year-old
lot
is
of
wild.
basketball growing up. We had that saying, no blood, no foul. So we're okay.
You're like, yeah, I've been prepared.
It's okay.
So let's talk a little bit about
Sure.
marketing. I'm
Okay.
always curious what successful businesses are doing. So, what percentage of your monthly sales is typically invested back into your marketing?
That's a good question. Right now, we're actually on the lower end and we're looking at kind of revamping how we are approaching our marketing because we
Nice,
want to kind of capture a little bit of a larger market and kind of want to
of course.
target a demographic of, I'm going to say kind of like yourself here. I want to find mothers of families. We all know that, mothers tend to make a lot of the decisions in a household,
Yes.
and we know that. I know that. And so if we can kind of, I don't want to say target them, but like focus on them, provide value to them, then we would hope that we can capture a family unit, right? It's not just one individual, but now you've got maybe uh, mom and a spouse and maybe kids. And then if we establish that trust, then over time we get the value of your client over time, over life grows the longer you take care of them. But also then we start supporting the community by trying to prevent a lot of these bad things from happening from a younger age, right? As I was saying, like we'll see patients, from kids all the way to elderly adults, and being able to do that provides a lot of opportunity again, just to kind of take care of the community. And so I think that if we can put a little bit more of our marketing efforts back into finding those family units and deliver a great customer experience, then at that point, like over time, we're really going to start to grow and take care of more of the community essentially.
Yeah, because moms, we tell each other everything. We're like, yeah, you should go here and get this and do that, blah 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 blah. So yeah, I'm surprised. Like I don't know, like because I pass you guys all the time, but like I've never been in there. But I'm like, there's so many different dentist like
Oh,
places.
absolutely.
I'm just like, it's so hard. But yeah, once you get like that one mom in there that likes to run her mouth and tell everybody, they'll definitely be like, you need to go here, take your kid here, take your kid here, like da da da. Or even like some of the influencers, I'm like, I've seen people go into like the dentist offices, so I'm surprised no one has even tried to be like, hey, can I come like do a video for, especially being here in Austin, like there's so many of them. You know what? I'm gonna make my own. Since I'm a mom, I'm gonna make my own and I'm gonna post it for you on my
There you go.
TikTok and
Okay.
like I'm
I
gonna
love it.
I'll do it for
Let's
you.
do it. Let's do it. I appreciate it.
We're
Uh,
gonna get the moms in
yeah,
there because yeah,
I love
I
it.
know I have one other mom friend
Okay.
here. I don't know where she takes her daughter. Her daughter's like 10 or I think she's 10 or she's like
Yeah.
9 or something. Um, but I Yeah, I'm gonna tell her. I'm gonna tell her about you because I know she has
Absolutely.
more teeth than my daughter, but I still need to bring my daughter in there, obviously. Um,
Happy to help however I can.
yeah, but I'm pretty sure she knows more moms than me, so we're gonna get the moms.
I love it. So, you asked me about the percentage of the marketing budget that goes back into it. Like I'd say probably right now we're about 1%. I definitely have plans to grow this to about 5 or 6, but if this thing takes off, then I might be able to just keep it where I'm at and we'll be fine. I don't know.
Right, exactly. You'll be fine. You'll be
There we
fine.
go. I love it.
So moving from marketing to sales, what does your guys' sales process look like? Like you obviously have to, do whatever it is you do. So yeah, what does that look like?
Yeah, great question again. I feel like it's a little bit different for everybody because it just depends on like the procedures or what we recommend that's going to benefit the health of the patient. But most of the time, it starts off by addressing whatever is the main concern of the patient. Like, oh, is this a patient that came in because have tooth pain? Okay, great. Let's focus on trying to address the big things first. Excuse me. And then if the patients are willing and wanting, then we start to kind of steer them towards a comprehensive care. Like we want to
Mm,
establish you as a patient of record, somebody that will continue to come in to do whatever it is that you need to do to take care of things rather than just like a one-off. Oh, I've got pain. Okay, we solved the problem. And then I see you
right.
again like 5 years later to
Yeah, I was
address
just
the
gonna say
next
like 5 years
problem
later.
in here. Right. Like, so sometimes that happens. And I'm not saying that those patients are not welcome in our practice, but our goal is to try to provide that continued level of care and whatever education and recommendations we can make along the way. But once we've identified issues or challenges or um, problems that we want to address, ranging from like actual disease process, you've got periodontal disease, you've got cavities, caries disease, infections, or
Look, some of these ones I've
whether
never even
it's,
heard of, like the
yeah,
periodontal, whatever you just said, disease. I was
it's
like, what?
basically really bad gum disease, really bad gum
Oh,
disease. Yeah.
goodness. See,
So
I'm like,
there's
I
a
never even thought I would have to worry about gum disease until I got pregnant. And then they were like, oh, yeah, this is a possibility. So I was like, what? What do you mean?
yeah,
I made sure I was brushing my teeth.
pregnancy and the pregnancy and the hormones with it can exacerbate a lot of like gum problems. It's not saying that if you're pregnant you then get gum issues, but
Right.
if you're not taking care of your teeth, then if you were pregnant, you probably have a more extensive response to not cleaning your teeth as well. But if you take good care of your teeth and you keep things clean, then you may not even have a response like so it does have an implication to it, but at the end of the day, yeah, all of these different types of diseases that we're trying to treat, even maybe an occlusal disease, like if you have a bad bite, your teeth don't come together properly, it's uneven, TMJ, joint disease, all this kind of stuff.
Yeah.
Whatever it is, we pose our recommendations, but our recommendations are often made only after we have a conversation with the patient, right? Look,
Right.
this is the issue. This is how I would recommend taking care of this. And then we kind of dive into, is this something the patient even wants to do? Do they
Hmm.
care? Do they not? Because if they don't or they don't want to, then it really doesn't matter. Like it doesn't make a lot of sense to just throw
Right.
a bunch of these recommendations out. My goal at that point is just to kind of educate on the consequences of doing something, trying to fix a problem, or the consequences of choosing not to do something, right? There are still things that you have to deal with if you choose not to address a problem.
Right.
And so we try to have
Exactly.
this conversation to set the stage, not just for solving immediate issues right now, but what does this look like in 3 years, in 5 years, in 10 years? How do we set you up for success? Can we do this? Sometimes patients are like, yeah, I'm all on board. Other times, like I can't do it. Maybe it's a financial constraint because,
Hmm.
realistically, dentistry is not cheap. Um,
No.
and you only get so much that you can get done with
At a time.
insurance or
Yeah.
like
Right.
yeah,
Right. Right.
exactly. So it's a long conversation between balancing out how time works, how a patient might kind of evolve over that time, and then trying to just prioritize what's best. But once we've identified that, our goal is to always be as transparent as possible with our pricing. We are always spending a lot of administrative time and resources for like my team to contact our patients benefit, or sorry, contact the insurance companies of our patients on their behalf ahead of time trying to get all of the information from them so that we can give as accurate of an information or estimation of what to expect from a financial perspective as possible. We try to go over all of the risks, the benefits, the alternatives to the different treatments, and then kind of have them sign basically the treatment plan, acknowledging what we've told them, giving them a chance to answer
Mhm.
questions. We always want to make sure they're aware. And then, once they kind of say yes to all of these things, we figure out a way to actually pay or afford for the treatment. We talked a little bit about our options with that earlier. And then we get them back on the schedule to do stuff. Or sometimes we can even squeeze in same day things. Like if we have enough time on the schedule, maybe we found a small cavity and we want to take care of it right then and there.
Mhm.
So you don't have to come back again. Sometimes we just try to do it in the
Right.
same day. Saves you
Yeah,
a
I'm always
whole
like,
other
go ahead,
visit.
take care of it, because I like, yeah, right. I don't have to come back in a week
Yeah,
or
I'm
like a
already
couple
here.
days, whatever.
Yeah.
Yeah,
So
I
when
love
we
that.
can, we can. Sometimes, the schedule doesn't quite allow, and we always want to be um, respectful of all the patients who have already scheduled appointments ahead of time. So we
Right,
don't
of
want to just
course.
like have the 1 day thing get in the way. But if we can do it without too much of a disruption to the day to day, then yeah, absolutely. However, we can add more value to our patients, I want to try to do that.
That's awesome. So let's fast forward and take a look at what's to come next. Where do
Okay.
you see the business in the next 3 to 5 years?
That's a good question as well. I've thought a lot about this. Um, the business itself, when I bought it, there was a lot of capacity to grow. And so my goal over the next 3 to 5 years is to kind of revamp and redo a few of the things within it to kind of modernize and to um, just kind of reinvest in the technologies and the things that we need to help deliver a great patient experience and great patient care. But I do expect and anticipate the business to grow. I expect us to be able to take care of more of the community. And really, once we can dial in our systems and how we deliver this, my thought is maybe at the 3 to 5 year mark, we might even look to expand to a secondary location. We might look to
Oh, I
expand
love
our
that.
current footprint. And then I actually have some other plans. This might be a little outside the 3 to 5 year range, but assuming we get all this other stuff squared away first, I actually have been looking at what it might be to help or I guess address an access to care issue, especially with the aging population. Um,
Yeah.
Wanting to see what we can do from like a mobile service, maybe to even get out to
Oh,
communities so
yeah.
they don't have to
But I'm like,
physically
there's
come to
so
our
many
location.
things going mobile now. Like that would be awesome. I don't think I've ever seen like a mobile dentistry, like, but that would be awesome. So I'm like, you would hit so many people. Not like literally hit them, but like, you would hit so many different
Not in the mobile unit.
people.
Don't want to do that.
It'd be like typical Austin driver.
Yeah, so I don't know where exactly it's going to go, but it's been on my mind as far as just how do we have a bigger impact again on supporting the greater community. And if I mean, this is probably way down the line too, but if we have some really solid systems and everything just seems to be flowing, then yeah, I'm all open to like how do we reproduce this in a different place in a different location? Can we affect more of the world in that sense, right? Like bigger businesses
Yeah.
get, the more reach you have. Um, and if we can do those things, I think there's a lot of room in the dental industry help help more people, to help more patients.
Yeah. I love that. Well, you've had a very interesting story, Justin. But as we
Thank
wrap
you.
up, I do have
Yeah,
a few rapid fire questions. Are you ready?
let's do it. I guess so. Let's do it.
Okay. What is the key to success for you?
Key to success is to keep moving forward. One foot in front of the other. Times might be easy, times might be hard, but you kind of just keep moving forward and try to be a little bit better, the next day than you were the day before.
I love that. Oh, great. What is one piece of advice for other business owners that you have?
Get into a community of people in similar situations or find mentors of people who've done this before you. I've always been a big proponent of not having to relearn lessons over and over. But as I've gone through this, there's a lot of stuff where I think I know it. You don't really like internalize the lesson until you go through it. Like just as a quick
Yeah.
example, I read the book E Myth like maybe 10 years ago. And it was really important and enlightening to be like, oh, okay, yeah, that's the kind of business I want to run. Like I want to have everything set up so it's not necessarily dependent upon me. But here I am 4 years into the business, and I'm like, oh, I reread the book. And I'm like, man, I always told myself I wasn't going to do this, but look, here I am, and I'm spending all this time, blah blah blah. And so it's kind of funny, but I do feel like trying to learn and then really just try to find that community around you because business ownership can be kind of isolating. I used to keep in contact with like a lot of my dental friends, and some of them have practices, some of them don't have practices, but the ones that
Mhm.
don't, like the things that kind of come up in my life now, like it's not so much the dentistry anymore or interesting cases. It's, well, how do I handle this administrative issue, the hiring, the firing, the business side of things, and not everybody can always relate. But finding a good group of people that you trust, working together, what's best practices, what works well in your industry, maybe it has some parallels in another industry. And so trying not to be too isolated, I guess, is what I would encourage people to not not do or not be in.
I like that. This one is kind of fun question. If you had
Mm-hmm.
a bit of magic dust and you could choose one spot of your business to sprinkle it, where would that be?
If I could sprinkle something there, it would be on maybe like the patient, the way we interact with patients better, especially
Mm,
around insurance because it can be so confusing for the
yes,
customers and the patients specifically, but also even for us too, right? Like sometimes the insurance company will say, yes, we will do this or we will cover this. And
right.
then sometimes we do it and then they say they're not going to pay for it anymore. And so, like, well, now
And
the
it's like, well,
patient's
what?
mad. Yeah, the
Yeah.
patients are
And
mad.
then
We
they're
look
probably
like the
mad at
bad
you
guys.
guys. Yeah.
Yeah, we look like the bad guys. So that part is really hard, but I get it. It's so challenging. It's so convoluted. Um, I mean, we always do our best, but we're human too, right? Like it's never going to be perfect. And I would hope that there would be, with the magic dust, more understanding on the patient side, but also more understanding for us. And I wish there was a way to solve this whole problem, but I don't know what the answer is. I'm not the leading
Right.
expert in all of this. I know different groups of people know this way better than me, and I just kind of like listen to what they're trying to say and
Exactly.
how do we do this? But I don't know what the win-win scenario is in this case. I really don't. And I've always been a win-win kind of guy, and I don't know what the answer is. So if the
Yeah.
magic dust can make that happen, oh, that'd be great. That would save everybody heartache and trouble and solve a lot of
Have
problems.
a lot more happier like customers, like
Oh yeah, absolutely.
oh my gosh. Okay, well, before we get to the final question of the day, will you please share with
Okay.
our audience how they can follow you, learn more, and contact you?
Yeah. So I mean, I know this will be a little bit more local. I don't think anybody out in like California or Washington is going to want to fly to Austin for us to take care of your dental needs. But if you want to, I'm happy to do so. But yeah, we're located in Northwest Austin, again, off of McNeil. Our address is 6500 McNeil Drive. I mean, we're here as a resource. We always want to help people, even when we have patients that go, oh, I'm relocating somewhere else. Like if I know good dentists or if I know good people in these areas, like I will say, hey, look, go check out this person here. Try to help provide them help. If it's somebody that just doesn't want to see me anymore, then I also say, hey, look, just tell me how I can help. How can we send records to the next place just to help a patient get as seamless of care as possible, whether or not it's with us? Like, happy to help wherever
That's
we
so
can,
nice.
but I get it. The same point, like we're not going to be the right person for the right dentist for everybody. You got to find that
Right,
person you believe in and trust, and whomever that is. If it's not me, that's fine too. Just want to help you however I can.
right.
But
I
yeah,
love that. That's so nice.
we have a few social pages. Our Instagram is just Advanced Dental Care Austin. We've got a Facebook page, but frankly, like you can interact with us on those. And like I said, we're here to be a resource to help our patients, to help you. And yeah, tell your friends. Hopefully, the people that are local, it'll be easier for us to take care of them.
Right, exactly. Anyone in Austin, Texas, or Cedar Park, Round Rock,
Exactly. Like
come
yeah,
to
this
the north
Northwest
side of
Austin.
Austin.
it gets real big. I get it though. Austin traffic's bad. I don't have a South Austin location yet, but I know a lot of good dentists down there. So if you still need help, we'll point you in the right
Look, he's
direction.
like, look, he's like, I'm still helpful. I'll still help you. Find
Yeah,
somebody.
that's all I want to do is just help people, right? Like we get
Yeah,
into dentistry to help people. Like, most
right.
dentists will tell you that they do that. And
I wish more people were like that in their roles anywhere that they're at, like any job. It's like
mm,
just be helpful. Like that's all you have to do is just be helpful and be a nice person also. Be nice. People are mean and you don't have to be mean all the time. Not you,
yeah,
technically, but I'm like
definitely,
anyone out there who's mean, stop being mean.
definitely, I would agree with that. Try to give people grace too, right? Like I don't want people to feel like they're being
Yeah.
judged on a bad day or their worst day. But likewise, we're human as well. Things happen and just try to be understanding. And I think with being in business too and in dentistry and it being kind of just really like a high stress situation all around, like I just try to give at least the same level of grace that I would hope I can give myself. Like I'm hard on myself, but that
Oh
same
yeah.
level of grace to other people in the midst of it, right? Like, yeah, maybe it's a misunderstanding, maybe things didn't work out, whatever. Just try to be helpful, try to be kind, try to be respectful. Like, nobody's gonna, it's gonna be a lot harder to get along or get what you want when things are really salty or, really aggressive at times. So that's
Right.
just kind of how I choose to approach the world, both in and outside of business.
Yeah. So we have come to the final question of the day, and that
Okay.
is what is most inspiring to you?
I know this is going to sound kind of cliche. This is one of the questions I thought about ahead of time, but my family is really the most inspiring thing. Like all of these things that I'm doing, I'm trying to make sure that we're doing it for setting up basically the world to be as whatever change I can affect or whatever impact I can have or whatever that ends up looking like. I want all of that to be better when I leave this world, I guess, than
Right.
I was when I arrived. And so that's setting it up for my family, for my daughter, for future generations. And I think really having the impact in just serving the human race and the community is something that God has put on my heart to be sort of like that primary directive.
Yeah.
Um, I think it's all a process though, right? You're learning, you're growing, and you're doing these things along the way and things may change over time too, but that's what's inspiring to me right now is just how do I live out my life to be successful in all of these ways, not just
Yeah.
it's not a measure of money, it's not a measure of just success or power, but like just the impact that we have. And then that's what I that's what I would say is kind of inspiring me
I
to keep
love that.
putting one foot in front of the other.
Yeah, I love that. Well, this has been a great conversation. I've actually really, really enjoyed your story
Oh,
and
wonderful.
everything
Me
that we've
too.
talked about. Yeah, of course. So thank you so much for sharing, Justin. And also, I encourage all of you who are watching to save this show and come back again because Justin had some really great insights for business. And please do not forget to like and subscribe to our channel so that you can get notifications every time a conversation drops, just like this one. And thank you so much to anyone who joined us today. And a special thank you to you, Justin, for being here with us today. We really
Yeah, my
appreciate it.
pleasure. Thank you. Yeah, it was my pleasure.